Good evening, dear friends. I am Dr. Kuldeep Jain, Director KJIVF and Laparoscopy Center, Delhi. I am a infertility and IVF consultant, and this week we are celebrating India's contribution to field of infertility and IVF, and I am very happy that CIPLA has come forward to make infertility and IVF problems known to all masses who are suffering from infertility, and they are not getting the right direction or right treatment during their management. So today I am going to discuss few of the important points which are related to infertility treatment and especially IVF treatment. Infertility is a problem which is not limited to one sector or one strata of the society. It is a social problem and it is a global problem. Whether you are rich or you are poor, almost 10 to 15% of the patients who are in reproductive age group, they suffer from infertility during their reproductive life. So it is a problem which is affecting each and every strata of society. There are a lot of advancement which have happened in last 30-35 years, and one of the most important advancement which has come into the field of infertility management is IVF, which is usually called in the simple language, and everybody understands, that is test tube baby. So in vitro fertilization or IVF is now not a new procedure. It is almost 35 years now when the first child was born through in vitro fertilization, and not many people are knowing that second child through this procedure that is called in vitro fertilization was from India. And today I salute the pioneers of India, Dr. Subhas Mukherjee, who was behind the second birth of in vitro fertilization baby from India. So keeping that in mind, I will like to give you a few points regarding infertility and IVF. These are the questions which I keep on hearing from my patients and as well as from doctors. There are a lot of myths which are attached to infertility and IVF treatment especially. And these myths are because of lack of awareness at the level of society, at the level of patient, and again at the level of doctors also. So I will be touching few myths which are associated with the treatment of infertility and why they are there, and because there is lack of awareness. People do not know what is in vitro fertilization, how it is done, and what are the advantages and disadvantages of the procedure. So when we talk of myths of IVF which are related to infertility and IVF, there are a lot of myths which are there. One of the important or very common myth is that IVF is not natural. Many people think that because it is baby is being developed outside, and many patients, they think that when the baby is fully grown, that is given to the patient. So that is a very common myth which is attached to in vitro fertilization. Second myth is people always think that it is the last resort. So they continue to go from one doctor to other doctor in search of the simple solution. it is not the last resort. I will, in further discussion, I will tell you why it is not the last resort. So this is a myth. This is not the fact. Fact I will be discussing just after few minutes. Another myth which is there, it is always done with donor sperm. Again, it is a myth. It is what we do in IVF. We take the husband sperm, take the wife's egg, and fertilize, and that is used for to create a baby. So again, it is a myth that it is always a donor sperm. A very common myth is attached to IVF is the bed rest. People think that 9-month bed rest is must when you conceive by IVF, and many patients, they don't go for IVF just because they are doing their job and they cannot leave the job, or when they plan IVF, they quit the job. So again, these are the myths which are attached to IVF. It is very painful procedure. People think that it is very painful procedure, so they try to avoid. Another myth is baby will be defective. When you conceive by in vitro fertilization, the baby will always be defective, or it will be unnatural, or these are some of the myths which are attached to in vitro fertilization. Another thinking in the common people's mind is when the IVF is not getting successful, you go for surrogacy because that will give 100% result. Again, it is not true. Surrogacy is a form of IVF where when the uterus or the what you call garbhasay is not receptive, or the endometrium where the embryo is implanting, that is not up to receptive mark. So that these patients, they require surrogacy. Not all patients, they require surrogacy. Another myth which is very common, that you only have 3 chances in IVF, and if you don't conceive in 3 chances, you will not get a pregnancy. So these are some of the common myths which are attached to IVF. Then there are some questions which usually comes in the mind of the patients. Is this the right treatment for me? Why you are? I am very young. Why you are suggesting in vitro fertilization to me? It is a last resort. And then many patients, they think, and they keep on asking how many days of hospitalization will be required. Does it involve operation? Whether my husband's sperm will be used or not. And last and very common question is, can you give 100% guarantee? So these are some of the questions and myths attached to in vitro fertilization, and I will take them one by one. But as I have told you, these questions or myths, they are because of the improper knowledge, lack of awareness, as well as the feedback which they are getting from the patients who may have undergone the treatment. So what I will like to do today, let me tell you what is IVF or allied procedures. So most of the questions which I have raised here, or myths I have raised, will be answered during this discussion. Now in IVF, what we are doing, in normal circumstances, the egg forms in the ovary and it gets into the tube. Fallopian tube is the transporting media of egg and sperm, and this is the place where the initial child formation occurs. So once the egg forms in the ovary, it is released and it reaches to the tube. And during normal contact, sperms are deposited in the vagina, and then they travel into the tube. And in tube, the sperm and egg are reaching together, and egg gets fertilized, and initial development of embryo takes place just after that in the tube. And finally, on 5th or 6th day, the developing embryo reaches to the uterus, where the endometrium or the bed is already prepared by the nature because of the hormonal process which is going on simultaneously. And the implantation process starts, the embryo embeds into the uterus, and finally a pregnancy is achieved. Now in IVF, if in a patient, if there is a problem in the tube, so the egg is not reaching into the tube, or in some patients where the problem of sperm is there and sperm is not reaching to the tube, these patients, they require IVF. So all patients who are having tubal problem, whose tubes are not patent or they are not functioning, they will require IVF. So whether you are young or old, if your tubes are blocked or tubes are defective, then there is no other treatment. One can get operated for the tubal problem, but again the chances of success will depend on the damage of the tube. So this is one of the indication where we plan IVF. Second indication, if your sperms are very few or very less, then you will require IVF because your sperms are not reaching into the tube. And there are not many medications which can improve your sperm quality. Of course, there are few medicines, but if you are not conceiving by these simpler means, you will require sperms. And a certain amount of sperm is required to reach to the tube to fertilize the egg. So if you are not having enough sperms or very few sperms, or you are not having any of the sperm, then you will require surgical retrieval from the testes, and then these sperms can be used for fertilization. So these are the patients who will require IVF even at the younger age, very young age. Then there are other problems which will also come into play. So when we say that it is the last resort, it is not the last resort. It is the first resort for the problems of sperms, where you are having very few sperms, or in those patients where you are your tubes are damaged and they cannot be repaired. So in these patients, usually in younger patients, we go for IVF. Then another thing was it is not natural. IVF is not natural. Again, it is very wrong to say, because here nothing is unnatural. It is a type of treatment, and when we offer any treatment to a patient, it becomes a natural for that particular patient. Here what we are doing, we are using the husband sperms as in natural conception. We are using egg as in natural conception. So only what we are doing outside is we are fertilizing them outside, because the sperm and egg cannot reach to the fertilization site. And once the embryo is formed, it is again developing into the female uterus only. So it is not a natural, it is not an unnatural process. It is just helping the nature where the nature is failing. So that one has to understand that when the nature fails, you have to give them a helping hand. And how you can help, depending on the problem, medical science can help in getting the natural conception. So this myth that IVF is not natural is not true at all. As far as the myth that it is the last resort, again it is not the last resort. It depends on the problem. If you are having a problem which can be corrected, then it becomes a secondary option for you. But if the problem cannot be corrected by any other means, then it becomes the first resort to you to get a conception. Another myth which I wanted to share, it is always done with donor sperm. No, it is not like that. If if you are having very few sperms, because now the we can go beyond IVF, that is intracytoplasmic sperm injection. So IVF, in IVF, what we do, we take out the egg, we take the sperms, and we mix them together in a dish. Now, if the sperms are too weak to fertilize, we can go beyond this procedure. And this is another extension and which has revolutionized the treatment of IVF or infertility, that is called ICSI. So where only few sperms, when they are available, we can take one sperm and can inject into the egg one by one on a very high end machine that is called micromanipulator. So ICSI is again available for those patients who are having very few sperms. So until unless there is no possibility of retrieving the sperm, even in those patients where the sperms are not coming in the ejaculate, but the husband is producing sperm and they are not able to come out. So even in those cases, we offer a treatment which is called surgical sperm retrieval by from the testes. So we can take sperm directly from the testes out, and then they can be used for fertilization. So again, it is not right to say that only donor sperm can be used. Donor sperm are used only in those cases where there are no sperms in the body, there is no treatment for that, and there we explain the procedure and give the option to use donor sperm. So again, that is a myth which needs to be clarified. Next myth is bed rest is must in IVF. No, it is not like that. Again, the conception, as I have told you, that conception is occurring in the uterus only as in normal process. So when you don't require a bed rest in a normal pregnancy, then why you will require bed rest in vitro fertilization or IVF? So again, it is a myth. We encourage our patients to work continuously, working. They need not to take any leave from the job. So one has to understand that if you are not sick, and here when you are conceiving, you are not sick, you are just as normal as any other person. So whether you conceive by normal natural conception or by IUI or by in vitro fertilization, you don't require any bed rest. That is not going to help you in any way in getting a better pregnancy rate. Moreover, it will add to the stress and which may go against your developing pregnancy. So one need not to take any rest after in vitro fertilization, and your pregnancy will go as natural as it can be. Another concern is it is a very painful procedure. Again, it is not a painful because we are not admitting the patient. You don't require any admission, you don't require any operation. It is only you have to receive few injections. Now, pain of injection, that you have to understand that we need to develop more eggs, and for that we need to give you few injections. That is the only pain which you will have. Rest of the things, when we remove the eggs from your ovary, you are given a simple anesthesia which is only for 15 minutes, and that is it. So it is not a painful procedure. You continue working as you are working normally. So again, that is a myth which one need to understand. Now, another concern which is always there in the mind of the patients, and it is a myth again, that baby will be defective. Now here what we are doing, we are taking the normal egg from the female and from the patient husband sperms. So the development of the baby is as normal as in any other case. So as far as the defectiveness is concerned, there is no proven data. Till now, there are millions of babies they have born by in vitro fertilization, and there is no definitive data to suggest that there is a increase in the defectiveness. If there are few reports of increased defectiveness, then they are because there is a problem in the egg or there is a problem in the sperm, and that is passed on into the baby, as happens in the natural conception also. So those patients who are at high risk of getting a abnormal baby, or some patients they are having history in their family that the defective baby are there, so they are at high risk. Otherwise, the procedure as such does not increase any increase in the chances of defectiveness. Another concern which is very common, that there are three, if you fail by 3 times in IVF, you will not conceive. It is again not like that. What is the purpose of this thing? Like, there are very high chances that you get a pregnancy if you go for 2 to 3 cycles. So people should not plan for single cycle, because in a natural conception, in 1 month, there are only 15% chances that you will get conception. When we are working outside, we are doing in vitro fertilization, we are increasing the chance to 45-50%. So it is 3 times higher in IVF. But still, some of the patients, they will remain and they will not get conception in first cycle, and that's why they have to go for multiple attempts. They can go as many cycles as they want. Only thing is, most of the patients, they do conceive within 3 cycles. That is the true fact, that every cycle adds to the chances of conception. So 70 to 80% of the patients, they do conceive within 3 cycles. And if they don't conceive, probably there are more problem. And if there is a problem in egg, then we usually, these patients, they are difficult to conceive, or we are not having good quality egg, or if we are having very few eggs, then chances of conception decreases. And in these patients, again, there is a solution, that if the patient is elderly, most of the eggs are not normal. And in these patients, the treatment is again IVF only, using a donor egg. If the sperms are defective, then again the chances of conception will be less. And if you don't conceive after 3 cycles, and if your sperms are very few, then you can take the sperms, donor sperms, or the sperms are defective. So there are the solutions even after 3 cycles of 3 cycles of IVF. We continue to add. There are a lot of advances which can really help you in getting the conception even after multiple failures. So it is not right to say that if you don't conceive in 3 cycles, you will not be able to conceive. I think I have already answered lot of queries, most of the queries here, which usually comes to me. As far as the cost of the procedure is concerned, it depends on the various factors, because the cost is having 3 parts here. It is the cost of the injectables or drugs, it is the cost of disposables, again they are costly, and then finally the procedure cost. So that can be variable, but on an average, the cost of the cycle is usually, in a good center, it is around 1.5 lakh for 1 cycle. So if you are being offered a cycle which is less costly, probably you are not at the right place. So because drugs are costly, the disposables are costly, so if somebody is offering you a cycle which is less than this cost, then probably your cycle is being compromised. That is what I will like to share here. If you are having any other questions, you can always contact me. My phone number is 9810018951. You can visit on my website www.kjivf.com, and you can get in connect with me on WhatsApp or by message, or you can visit my website. uh, I will be happy to answer any queries regarding the infertility or regarding in vitro fertilization. Thank you very much for your time. I will connect with all of you again shortly in coming month. Thank you so much. Uh, yeah.